Huh? Before birth. From? Before birth. From? After pregnancy. From the day of conception. From the day of conception. That is 0. Day of conception is, you know that. When the mother gets conceived, that day the life starts. Not after the birth. The software will develop during the pregnancy period itself. The child's life, whatever you call it as a software or hardware, everything will be formed during the first 1000 days. That is from the day of conception. 0. But what we are doing? After the birth, once the child reaches the 1.5 year or 2.5 or 3.5 years, we are starting to care the child. Like, my child is not walking, my child is not speaking, my child is having some developmental delay, we are going to the therapist or the doctors. But before only everything is happening. This is what the significance of the first 1000 days. He is my teacher, Dr. P. Sudarshan Reddy Garu, ex-superintendent of Government Neelofer Hospital, head of the Department of Apollo Institute of Medical Science, Department of Pediatrics, who is my teacher, and I am dedicating this session to my teacher. So, a happy family is a healthy biological unit in the society. So, everybody knows that. What is, happy family? Which family is happy? Anyone? Any family is happy? It's a question mark. Yes? Yes. Show me a family which is happy and harmonious, without any distress, without any emotional trauma or some other problems. There is no one. So that is a universal fact. There is a need for universal nurture curriculum from 0 to 3 years. Everyone is concentrating on the syllabus and curricula for the school age. Syllabus. Syllabus means first class syllabus, second class syllabus, third class syllabus, LKG syllabus, UKG syllabus. But why we are not focusing on syllabus, curriculum from 0 to 3 years? Again I am repeating, 0 means from the day of conception, 3 means till the second birthday of the child. Second birthday of the child. So entire software and hardware, the anatomy and physiology and biochemistry, everything, the child's life, the child's abilities, strengths, weaknesses, disabilities, difficulties, disorders, everything will be formed during the first 1000 days only. But it is very difficult to identify those problems during the period of development. So we need to know, we need to have some kind of awareness. For that reason only, today we are assembled here. So intellectuals solve problems, and this is just a minute. Back. You are moving? Next slide. Intellectuals solve problems, geniuses prevent the problems. So we are concentrating on prevention rather than treating. Preventive aspect is very important. Why my child born with some disability? Why? What could be the reason? Where the problem started? Where the damage happened? Why my child is suffering with so and so neurodevelopmental disability? So something somewhere happened. So to prevent that, we should have some kind of awareness. So that is what the geniuses, who are the geniuses? Parents. I want all the parents to be a genius to prevent the problems, not the intellectual to solve the problems. So there is a lot of difference here. Next. This one? Okay. Even recently, the National Early Childhood Educational Policy is very clearly stating that birth to 3 years of the age, we need to focus. Birth to 0, that is 0 to 1000 days. 3 years means, please don't think that 3 years of age. Again, I am repeating, 3 years means second birthday of the child. 0 means from the day of conception. Please do focus. This is what the National Educational Policy, the recent National Education Policy is stating that. Even the UNICEF, even the WHO also focusing on 0 to 3 years of the age. So we need to focus about the survival of the child, safety needs of the child, and also protective environment. So what type of protective environment which we are giving to the child during the pregnancy period, not after. I am talking about before, prior to the birth, that is during the antenatal period or pregnancy period. We need to provide a right environment, which is a protective environment in so many domains like nutritional status of the mother, psychosocial stimulation of the mother, and also other areas. Everything, that is what the safety and protective. And of course, health care. We need to identify the deficiencies in the antenatal mother. What are the deficiencies? Zinc, vitamin D, calcium, iron, folic acid. All these are all very important, because these are the very important micro and macro and also minerals, which are very essential for the baby's growth and baby's development, that to the proper development. If the antenatal mother is suffering with certain deficiencies, definitely, certainly, she is going to give delivery to a child with some kind of neurodevelopmental disability. So what are the neurodevelopmental disabilities? It may be a cerebral palsy, it may be autism spectrum disorder, or it may be attention deficit and hyperactivity disorder, or it may be a specific learning disabilities like dyslexia, difficulty with language, dysgraphia, difficulty with handwriting, dyscalculia, difficulty with arithmetical operations, or dyspraxia, movement problem, or some kind of problems. Down syndrome, Turner syndrome, Marfan syndrome, Smith syndrome, Asperger's syndrome, Prader-Willi syndrome. There are so many genetic causes. Some kind of problem, okay? So we need to take care of the mother, pregnant mother or maternal mother, not the child. Child is the secondary. So what is the important home message here? We need to care the maternal mother or antenatal mother or prenatal pregnancy period. That is what? So nutrition, including infant and young child feeding practices, the way how you are feeding the baby, that also matters. Most of the mothers, they just feed, but they won't concentrate. And she will be concentrating on other aspects. Home chores. So that kind of rapport, a kind of psychological and emotional bond when you are giving the feeding to the baby, that matters a lot. A baby will feel a kind of, sense, a security feeling. That is very important. Care, concern, and also the love can be obtained the way you touch the baby. Okay? Attachment to an adult and opportunity for psychosocial stimulation. So all these are all very important, which are there in National Education Policy for early childhood education. So, birth to 18 months, most of the young mothers, I am using the word young mothers. Who are the young mothers? The mothers who have given birth to the first child. Because the mother herself, being a woman, she will be having so much confusion. First time I am giving pregnancy. First time I am delivering the baby. A kind of anxiousness, anxiety will be developed. And a kind of social and emotional, feelings also she will develop, because it is for the first time in her life, first time she is going to experience the pregnancy. So those are young mothers. Second child is again experienced mothers. She will relax. But the first time when the mother becomes, when the woman becomes pregnant, she will be having anxiety. So what she do? What she do? She will overstimulate the baby. She will overstimulate, not stimulate. Overstimulate. Overstimulate is overcare, overconcern, overfeeding, everything over. That is called overstimulation. Very dangerous. Please do not overstimulate the baby. Sir, I did. That's what the child is ADHD. There are other factors. Okay? Overstimulation causes some problems. Hyper or hyposensitivity problems, or hyper or hyposensory issues, or sometimes ADHD, attention deficit and hyperactivity disorder, whether it is borderline or mild or moderate or severe or profound. So please do not overstimulate. The overall goal is not only to teach baby but to interact and explore. Giving instructions is different to a child. Do this, don't go there, don't do like this. But working with the child is different. Where and when the child learns? When you started working with the child will enjoy, the child will learn. When you instruct the child may not learn. When you work with the child, when you interact with the child, that is called joint attention. Working together, dealing together. That is very important. So which we need to inculcate. So don't teach but interact and explore. When it comes to the developmental aspects, all of you know that. First month baby what she do. I don't want to say all this. I don't want to tell the normal developmental milestones. You know that. So basically the first month baby, what the needs are, need milk. What 1 month baby needs? Not to study ABCD. What baby needs? Milk. Basic biological needs should be fulfilled or met as per Maslow's hierarchy theory. You know the Maslow hierarchy theory. Basic physiological needs should be met first. What are the basic physiological needs, biological needs? Hunger, appetite, thirsty, sleep. These are the basic. Taking milk, sleeping. Taking milk, sleeping. That's the only thing what the baby knows. Yes? If I disturb the baby sleep, what happens? If I stimulate the baby, if I won't allow the baby to sleep properly, a 1 month baby for 20 hours, what happens to the brain of the baby? Something will happen. When I will come to know? After 3 years. When my child started not speaking. When my child not getting good marks. When my child identified as a slow learner. When my child is hyperactive or overactive or develops childhood anxiety disorder. So don't disturb the baby sleep. And give time to time the milk. And a warm place to sleep, and also baby needs hugs and kisses. Not over hugging, over kissing. Limited. Yes? Don't overstimulate. The more you talk, introduce different things, the more learning. More you talk. Such a beautiful phrase. More you talk, not more giving toys to the baby. I want to make my child as a best father. So what I will do? I will bring 50,000 rupees toys to my baby. Oh, my father brought 50,000 rupees toys. What is the use? No use. Then what I have to do? Being a best father, I have to interact with my baby. I have to spend quality of time with my baby. That is what it leads to the development of speech, language, communication, reciprocation, and other skills. If I give toys, baby will interact with the toys, so my baby's speech, language, communication development will be affected adversely. So what I have to do? Human interaction should be enhanced. Human interaction has to be facilitated by interacting with the baby. Yes or no? If I give toys, baby will play with the toys. If I talk with the baby, so many skills can be developed. Like what? Personal skills, communication skills, sensory skills, speech language communication skills, social skills, reciprocation skills. So many skills can be developed if I start working with the child. So the more I spend time, the more learning will take place in my baby. Got it? Yes. So you know the third month, what happens? Needs talking, feeding, singing, favorite songs and lullabies. All of you know this. Fifth month baby again needs learning to crawl, needs happy sounds, not adverse sounds. If I started scolding the baby, if I started screaming to the baby, what happens to the baby? The emotionality will be affected. The baby's emotions will be affected. It will affect the future EQ. EQ means emotional quotient. There are some quotients. Everyone concentrate on IQ, intellectual quotient or intelligence quotient. But IQ is now least bothered topic. So what is bothered topic nowadays in global society? EQ, emotional quotient, emotional competency, social quotient, social competency, spiritual quotient, spiritual competency, and also developmental quotient. These are very important rather than IQ. So 9 months baby needs lock on cabinets, needs touches, need to be touched by the mother and father. So how many fathers are giving quality of time to the babies? It's a question mark. Or how many working mothers are giving quality of time? That is also question mark. But the baby needs to be touched. Tactile stimulation, proprioception. Here also 12 months baby needs lot of cuddling and encouragement. Expect praise. If you have done some good work, naturally you expect some kind of praise. Yes or no? Today you cooked well, but your husband or your in-laws or some family members did not praise it to your effort. How you feel? Yes? So the child also expects some kind of praise from you. So give praises frequently to encourage, to develop or to improve certain skills in the child. The toddler's creed, if I want, it's mine. You know the psychology of a toddler. How he behaves? If I want it, it's mine. Whatever the toy, whatever the activity, whatever the person. If I give it to you, change my mind later, again it's mine. Kanjush fellow. He wants everything on his own. So this is what? If I take it away from you, it's mine. If it's mine, it will never belong to anyone else, no matter what. If we are building something together, all pieces are mine, the blocks. If it looks just like mine, it's mine. Everything is mine. The house is mine, this house is mine, the home is mine, and the objects are mine. I am the boss of this family. This is the toddler's perception, toddler's psychology. Yes, nowadays parents are giving time to screens, electronic gadgets. It may be a YouTube rhyme song, or it may be some electronic gadget, maybe the laptop, maybe the video game, anything. So what is happening? The child is missing the peer group. The child is missing the social communication skills. So we have to allow the children to play with their peers. So we have to take them to the parks or grounds where the child can explore. So group is very important, group therapy. So these are the first 1,000 days. The first 1,000 days are pregnancy 270 days. And you know that first birthday, that is 365 days. Second again 365. Such a beautiful, wonderful calculation you see. 1,000 days. This is the God's creature. He is the architect engineer. First 1,000 days, 0 to second birthday, plays a crucial role and critical role in the child's development. So early childhood development, for every child, early movements matters. What are the early movements? What the child see, what the child touch, what the child hear, what the child feel, what the child sense. All these are all early movements, which matters a lot, which will, which will everlasting impression throughout the life. Everlasting means till death. So these are the foundation, pillars. You have to give the best to the child during the first 1,000 days, because that shows impact. So what you do, what you eat, and what you experience during the first 1,000 days has lifelong consequence. You know that most of the parents, generally they will take their children to the swimming. At what age you will take the children to swimming generally? 5 years? Yes, any other answers? 5 years, 8 years, 10 years, 12 years? Yes or no? Sometimes may not be there. No opportunity. Yes? But by the birth, the baby is a good swimmer. Do you know this? How? In the mother's womb, in the amniotic fluid, the fetus is swimming. Exercise is happening. He's a good swimmer already. Once he comes out of the mother's womb or the uterus, only thing is he should get the opportunity from you. You have to provide the opportunity. So naturally he will swim with the air tube around the neck. So during the first 1,000 only, he is a master. But the parents are not intellectuals. The baby is the intellectual rather than the parent. The only thing is, parents are not giving the opportunities which are right opportunities at right time, which is missing piece. So when it comes to the brain is a complicated than a computer. Do you accept? If I get some repair in the computer, I can go and or I can solve with some technician. And the brain, can you take the brain to a technician to repair it? Yes? How many of you say yes? Any technician is available for brain repair in the world, including God, who has given birth? No. There are two words, regeneration and degeneration. So brain cells degenerate, not regenerate. That's the difference. So that is why human brain is very complicated in this known universe. What the giraffe expects from the baby? Giraffe baby? My baby neck should grow longer. That is the giraffe mother expects. And what the monkey mother expects from the monkey kid? Jumping. Yes? What the peacock mother expects from the peacock baby? Beautiful feathers, colorful feathers. Yes? Yes. What the human mother expects from the baby? Intelligence. I want my child to be the Einstein or film actor or heroine. Height, weight, ball. That is what happening. But surprisingly, in this nature, all animals other than the humans, after birth, after delivery, they hop, they jump, they walk. But for the human, it will take 1 year, almost 10 to 12 months to walk independently, to speak 1 year. Whether it is babbling, whether it is jargon, whether it is specific meaningful word, at the age of 1 year. Most complicated species is a human. So, the first 1000 days, what are the windows of the brain? Windows of the brain are 5 sensory organs. Eyes, ears, nose, and the tactile, auditory, visual, tactile, and gustatory. All 5 sensory functions or 5 sensory organs are the windows. What is happening to the child with neurodevelopmental disability then? Keyboard 2 plus 2. I typed in the calculator. On the screen I can see 2 plus 2 is equal to 4. So this is input, this is output. Who is doing this? CPU, Central Processing Unit. So, the child with neurodevelopmental disability, the child with sensory processing difficulty is having difficulty with sensory processing. That is CPU problem. His eyes are normal, his vision are normal, everything is normal. The problem is with output because of CPU problem, processing problem. That is why these disorders are called as sensory processing difficulty or disorders, SPD. Execution difficulty, reciprocation difficulty, communication difficulty, sensory difficulty. Again, it is hypersensitive or hyposensitive. 90% of the brain growth will be completed by at what age? 5. Maximum. Do you think our brain will grow continuously? No. Maximum physiological, anatomical growth will be completed by maximum 5.5. Okay? At the birth, 100 billion neurons will be formed. 100 billion neurons, nerve cells in the brain will be formed. At the age of 3 years, each connection, see, 10,000 connections for each neuron. 10,000 connections. So what you have to do? You have to finish off the early intervention program before the age of 3 years. But when we are bringing the children to the doctors, at the age of 1.5 year, 2 year, 3.5, nothing will happen to you, beta. You also started walking late. At the age of 2 years, you started walking late. At the age of 3.5 years, you started speaking. Nothing has happened to you. Don't take to the doctors. Everything is fine. Who says this? Our great grandparents. They will tell. This bichara, highly educated person, he will follow that. And he will sit at home without going to the doctor for screening or assessment. So, who is going to suffer here? Huh? Child. Child is adversely affected. Who is innocent? Who is innocent? Because of parents, because of grandparents, because of society. So, who has to treat it here? First, grandparents, then after parents. Finally, we have to treat the child. Who needs sensitization program? Who needs orientation programs? Who needs awareness program? Parents and grandparents and society, not the child. Child is later, last stage. When actually these sensory pathways will be developed? When? After birth or before birth? Vision, hearing, language, cognition, intelligence. Everything will be formed during the pregnancy period itself. During the pregnancy. Do you think the child will start learning after? No. During the pregnancy only. It's a very important, most of the people do not know. Just a document that Indian mythology, Bhakta Prahalada story, Abhimanyu story you might have heard. During the pregnancy only, the fetus will try to respond. It is fact. Evidence-based fact. See, before birth only everything happening. Not after birth, before birth. Now, who is our target now? Pregnant women. If you look after your wife properly, if you look after your daughter-in-law properly, if you look after the woman's health properly during the pregnancy period, you will be receiving a healthy baby. So, how to look after? How to look after? By giving proper nutrition, balanced diet, proper psychosocial stimulation, proper emotional support, and also at the time of labor, presence of the husband. Everything matters. Yes? So we can arrest and we can prevent the developmental disabilities. Baby's brain is both complicated and vulnerable. Complicated organ is the brain. Vulnerable also. If you see when the parents are arguing with each other, if you see a conflictual situation in the home environment, if you see or listen or sense or experience the awkward means, abnormal or odd words or abused words in the home environment, it will affect the brain. What is the child right here? As per the Child Acts or Protection Acts or Child Rights, as a human right, the child should receive proper environment from the parents or from the home. Okay. If positive experiences do not happen, the pathways needs. What are the pathways? Sensory pathways, neuronal pathways. For example, I'll tell you the meaning of neuronal pathway. When you are going to the jungle or forest, basically what you will carry with your hand? Basically, one weapon, stick. You will carry a stick to clear the pathway and to use as a defensive tool if the animal comes. Okay, I am holding the stick, I am going in the jungle. Okay. If I go, the same pathway, one big road will form. No. If some 500 people follows me, a small lane will form. Yes. If 10,000 people follows me behind, a big line will form, road. If 1 lakh people follows me, a national highway will form. Yes. Suddenly on one day, everyone stopped walking in that jungle. What happens? What will happen? What will happen? It will become again jungle. What you learned from this? Brain, body connections, ascending pathways, descending pathways. Those are neuronal pathways. Okay, got it? Sensory pathways. To work, to facilitate, the therapy should be continued. The therapy should be continued. If you give gap to therapy, what will happen? The pathways will be closed. The pathways will be closed. Understood? If the debris comes on the way, if you are seeing but ignoring, what will happen? It will close, it will block the road. So we have to clean regularly. Regular therapeutic intervention program is utmost important and necessary for the overall child development. You have to use it or lose it. So please use it. Okay? Now, autism spectrum disorder, it became one of the epidemic in the world. You know epidemic? All of you are experiencing the pandemic. COVID. But one more thing is there. Autism spectrum disorder also becoming one of the global epidemic silently. So, what is epigenetics? Earlier, they used to tell because of the genes, the child got this problem. Now we are saying genes are listening to the environment. So if you give a right environment, the child development will be proper. That is called epigenetics. Genetics means genes, chromosomes and all. It plays 20% role. How much? 20%. Epigenetics, that is environment. Environment, how much it plays? 80%. Epigenetics, 80. So we have to concentrate on environment in which the child is upbringing or brought up by the parents. Everybody is taking a vaccine for COVID? Yes? What about your children? No? Why don't you give vaccine? Small children, achha, no vaccine is available. Huh? You know vaccine means? Love, care, giving quality of time, emotional bond. That is called inoculation. That is the basic primary vaccination. Are you giving this vaccine? Justify yourself. Emotional vaccination. I have given a word, emotional vaccination or inoculation. When the child is in the pain, are you available? Question mark. All the time? When you are in the pain, anyone comes to you? Doubt. Emotional pain, psychological pain. When the child is crying, are you available? Question mark. So emotional inoculation is very important. That is what epigenetics. So the growth of the baby brain literally requires positive interaction between mother and infant. Why only mother? Why not father? Why? Why the controversy here? Mother and father? Why only mother? Why can't father? From the father's body the baby came or from mother's body? Exactly. The child will have memory. He will listen to the mother. He will stop crying when the mother touches. When the father touches, he will not stop. So he is a foreigner. for time being. Again he will join later. That is the bond. Umbilicus. I say, for a woman in her life, 2 pregnancies are there. Do you accept this, all the women, respected women? 2 pregnancies a woman will undergo. 2 pregnancies means 2 times children. No, 1 time 2 pregnancies. Internal pregnancy, external pregnancy. Internal pregnancy means when the fetus is in the mother's womb, it will be connected to the mother body through umbilical cord. Yes, that is internal pregnancy. External pregnancy means when the baby comes from the mother's womb into this world, through breast, the baby will be connected. Lactating mothers means breast milk. Internally through umbilicus or umbilical cord, externally through breast, the baby is connected with the mother. That is also called, can be considered as external pregnancy. That is why I sincerely suggest all the families to celebrate child's birthday. On the child's birthday, the woman, the mother also should be celebrated, her birthday. 2 birthdays we have to celebrate. One is mother, second is child. But we celebrate only the child, not the mother. Start practicing this. Okay? Human brain needs communication, interaction with other humans, not with gadgets. Only 10 minutes only I am giving, sir, screen, YouTube, because my child is not eating. That's what I am giving. I am exposing to YouTube, rhyme. They say 10 minutes is enough to damage the brain. 10 minutes is enough. One small drop of poison is enough to kill a human. 10 minutes of interaction with the screens shows much damage during the developmental period of the brain. During the early synaptogenesis, that is early neuronal pathways time in the brain. So please do not expose the babies to screens. If you are exposing, stop it. What are the screens? Only mobile phone? No. Any kind of electronic gadget. It may be a mobile phone, it may be a tab, it may be a laptop, even TV also. TV also. I consider TV also. For example, I am a child. If I am seeing TV like this for 30 minutes, what happens to my brain, neuronal pathways? Robotic. If I interact with the humans, if I play with my peer group, the human interaction will help me to develop certain skills. If I interact with the gadgets, how can I develop speech language communication skills? Yes or no? I will not develop. So stop. Man is by nature a social animal, as Aristotle said. So we have to connect with other humans, not with bloody gadgets. Gadgets cause so much of damage in family life, personal life, social life, and everywhere. It may give information, but it is a silent killer. I told you this pregnancy, internal or external, both. So, umbilical cord is the earlier connection with the mother's body. Later, it is a breast becomes the new point of connection. So that is external pregnancy. Here one important thing is, sorry, it's gone. When the mother is feeding the baby, mother will be doing some work, or mother may be chit-chatting with other family member. That is called artificial feeding, just like a bottle feeding. When mother is feeding the baby in a privacy environment, in a protected, secured, safe environment, by patting the baby head, by touching the baby's hands and feeding the baby, that gives more development. That is called breastfeeding. That is called breastfeeding. As far as a breastfeeding can be defined as like this, not just giving physically. There is no emotional aspect here. So emotional aspect, psychological aspect are very important in the development of the brain. So during the breastfeeding only everything happens. Do not separate the mother from the child. I specifically highlighted mother. I told you the reason. If the mother separation is there, the child may develop separation anxiety disorder, sad, separation anxiety disorder, sad, childhood anxiety disorder, right from childhood only. That's what you observe. When the mother is going, the child will be after the mother. He will not leave the mother because of the emotional, physiological, psychological attachment. When the father is going, he may sit, but when the mother is going, he cannot. That is the emotional attachment. But intentionally, nowadays, the mothers themselves are getting separated from the children by working. No, sir, I am working from the home only, they say. You may be working from the home, but you are working for your job, not for the child. You may be holding the laptop, but the child is looking at you. Mummy, when she will come? Mummy, when you come and play with me? With hope, he will wait. But this mummy, she will scold him. Hey, go away, I am doing work. Don't disturb me. That don't disturb me, that apprehension, that facial expression will affect the baby's emotions. So he will develop withdrawal symptoms. There the point of separation starts. Emotional separation. That slowly leads to physical separation later in the age. It is true. That is why we call these mothers as refrigerator mothers. This concept has been developed in the 1960s. Lack of maternal warmth feeling from the mother is called as refrigerator mother or refrigerator parenting because of their busy schedule. Then why we have to give birth to a baby when you don't have time? Yes? We are not supposed. If you are having time, prepare and give birth. Otherwise, do not. Because the child's life is going to affect. Babies needs humans, not the screens. Very clearly WHO. Who said? Who means WHO, World Health Organization. What is the duration? No screen time for babies under 2 years. But nowadays, once the baby comes in this world, immediately the mother will take a selfie and post in Instagram and WhatsApp groups. So after coming to this world, the baby got exposed to screen. Just like X-ray, radiograph. Please do not. Why hurry? Anywhere he is going to face that on one day. Why earlier? Because of you. The behaviors that are the results of the screen time. If the baby exposed to screen time, so many emotional behavioral problems the child will be facing. What are those? Lot of list. Psychosocial consequences. He do not know how to behave with the peers and adults and elders and the teachers. He will become a robotic fellow. Too much of gadget exposure. And autism spectrum disorder. Poor memory, poor motivation, depression, childhood depression. Okay? And anxiety disorder, that is generalized anxiety disorder or childhood anxiety disorder. Poor attention span called as attention deficit disorder, ADD. And also poor cognitive function is nothing but less intellectual functioning or less reasoning or less analytical thinking and all. And poor judgment. He cannot judge because he is a gadget fellow. He will become a gadget fellow. He is not a human. He is a gadget, mini gadget, baby gadget. Yes or no? Yes. And also he may develop OCD. Obsessive compulsive disorder. He will not trust anyone. He will not trust his wife. He will not trust mother. He will not trust anyone. Everything doubts. Dilemmas. So many list of problems are there. Psychosomatization, that is psychosomatic disorders. Escapism. I am having headache, mummy, he will say in the home to avoid the exam in the school. I am having abdominal colic pain, he say, but it is not reality. He may develop hallucinations, delusions, illusions, which are visual hallucinations, visual delusions, auditory hallucinations, auditory delusions, hallucinations, which are not existing in reality. And dissociation disorders, introversion personality, extrovert, introvert, there are two types of personality. Introvert means fetus also exposed. The neuronal pathways also exposed. The neuronal pathways of the brain of the baby will be affected during the pregnancy period itself. So working women are not supposed to interact with gadgets. But everywhere you see, the phone will be carrying by women most of the time as a tool. If you leave this tool,